So this virus is going to be here with us for a couple of years more. There will be phases in which there will be no disease, but after a few months there will always be localized resurgence of the virus, but life will always go on as it has on Earth. So in this video, I'll be dwelling upon the enormity of the pandemic so that we as clinicians and you as patients do not let down your guard while you seek a hair transplant and while we in hair transplant clinics deal with patients in a safe manner in the coming months and the coming years. And like many other clinics which hold the patient safety in times of this pandemic supreme over all other issues, I will deal with all the measures that we have in place in our clinic and how we ensure that our clinic is a COVID-safe medical facility. During COVID-1 early last year, many medical facilities had to shut down and procedures which are non-essential, elective, were put on hold. This was basically done to conserve available resources and to minimize the spread of the disease. But patient response over a period of time over the last 1 year has changed, and people are now venturing out for hair transplants on a routine basis. So what are the reasons behind patients still seeking a hair transplant when the pandemic is still on? Well, lockdowns have had their effect on the psyche of patients. Lockdowns, because of increased stress, has caused more hair loss. Lockdowns have hastened the progress of baldness in many cases. And getting a hair transplant done is thought as an escape from pessimism and wanting to feel good. And hair transplants give respite to such people. And then there are patients who want to stick to their social and personal timelines. Like yesterday, I had a patient who came all the way from about 2,000 kilometers who flew down for a hair transplant from east of India because this young man is going to get married in December. So for him, hair transplant is number one priority. Other people want to get a hair transplant because they have an impression that hair transplants will be cheaper now than when traffic picks up, when air travel starts. They are true also to a great extent. And then there are patients, especially those working in the IT sector and the service industry, who are working from home. For them, this is the best time to recover, the best time to get a hair transplant done in all privacy, without people in the workplace, without relatives and friends knowing that they got a procedure done. And lastly, there are patients who rightfully feel that there is not much workload in cosmetic surgery industry today. And if they get a procedure done now, they will get all the attention of the doctor and his team. But then there are patients who have their own reasons, who want to wait for this pandemic to get over or for the spike to plateau down so that they can get the hair transplant done later this year. And what are the reasons they propound? Their reasons are, number one, they shy away from comprehensive medical precautions. They shy away from the restrictions of travel. Many fear traveling from one city to the other, fear of exposure, unnecessary exposure to the virus, because some feel that it is not safe to travel, it is not safe to go from one city to the other seeking a hair transplant. The other reason is that there is less cash paying ability at the moment. Many people have lost their jobs, some are working on half pay, and others are little hesitant to spend the money because they want to conserve their money for later because the future is so uncertain. There is a fear of a looming depression. And then patients who want to get the procedure done, who have the money, who can take the risk of travel, but then because of the pressure from the family, they have put off the procedure till later this year. So let's get down to understanding the problem of the COVID pandemic. Published data and experience from the last Spanish flu gives us an insight into how pandemics happen, in how pandemics wane off, and that there is no one wave. After we get complacent, a second wave will strike, and then perhaps a third one and a fourth one, till people get immunized, till people develop a herd immunity, or the virus becomes less virulent by mutation. So this virus is going to have long-lasting effects on us as human beings. It's not over yet. So when people get fed up of this, they are going to push back federal restrictions, federal lockdowns, and federal strictness in day-to-day life. So this COVID-19 virus is here to stay for some time. It is not going to go away very soon. We already see people getting fed up of it and pushing back federal restrictions on travel, federal restrictions on social events, and many other restrictions that happen from time to time in certain localities where the virus spikes. So, this is human nature, and keeping in mind this human nature, guidelines are being devised, and some have already been devised by certain organizations like the ICHRS on how to deal with surgeries during the pandemic so that the patient is safe and the doctor and his team are also safe during the procedure. So these guidelines and these algorithms will need to be followed very strictly if a medical center has to be called a COVID protected facility. Shutdowns are not the answer. The economy is as much important in sustaining livelihoods, preserving businesses and society in the process. So governments are not going to henceforth observe strict lockdowns like the Chinese model or the Indian model in the first phase of the COVID pandemic. So this virus is going to stay here for some time till the virus gets tired, fatigued, it mutates into less virulent forms, or the whole world population by end of this year gets vaccinated. But till then, most people still do not seem to understand the severity of the problem that is at hand, because we need to explain to them the risk in a quantified manner. They need to be told in very simple terms about the risk of dying from the coronavirus. Many people would say that life itself comes with risks. There are so many risks when we set out to work and by the time we come back home. So is the risk of corona far greater? So let us quantify this risk of dying because of the coronavirus. So let us quantify the risks that are posed by our daily activities, by our habits, and by disease. The risk that these activities pose to us can be calculated as per a unit called micromort. Micromort is the micro probability of dying because of a particular habit, a particular activity, or disease. The average human being undergoing day-to-day activity in a normal manner, not subjecting himself to too many risks, is said to have still a 1 micromort risk of dying. Now, what is 1 micromort? 1 micromort means there is a 1 in million chance of dying because of that particular habit, activity, or disease. It could be a non-natural cause which we don't even think of, like electrocution, dying because of a car crash, getting crushed under a tree, or remotely being hit by an asteroid. Now, translating the risk of COVID during this pandemic to micromort language, the average resident of New York City, given his healthy lifestyle, given the medical facilities available to him, runs a risk of 50 micromorts. That is, he has a 50 in a million chance of dying after contracting coronavirus. Now, we could relate to this further by giving an example. This risk is twice that of dying for a US Army official deployed in Afghanistan during the worst time of its crisis, that is 2010. And then you will realize the dangers of COVID virus. But then the acceptability of risk also depends upon your proclivity, your risk-taking ability, and whether one has a choice in this matter or not. Unlike bungee jumping into a deep gorge, where the risk is confined only to yourself, in a COVID-19 environment, if you are taking risk by not following laid down federal procedures, not wearing a mask, not maintaining distance, engaging in unnecessary activity, you are subjecting not only yourself, but you are increasing the risk of others dying as well. And this is without their knowing. Though there are umpteen number of enthusiasts, skydiving enthusiasts, no skydiving enthusiast will jump from a plane with his frail 90-year-old grandmother. But while the risk of your grandmother dying of a free fall after a skydive is much lesser than dying from contracting COVID virus, you still throw caution to the wind, not wearing masks, not following safety procedures at home, subjecting your grandmother, your frail grandmother, without her knowledge, to a risk which is far greater than the riskiest adventure you can imagine. So it is safer for you to take your grandmother out skydiving or bungee jumping into a deep gorge, but please wear a mask at home, because that is where her risk of dying is manifold. The risk of a person dying from anesthesia, on the other hand, is 5 micromots, just 5 micromots. Jumping from a plane, 7 micromots. Giving birth, 210 micromots. If you ride a motorbike for just 6 miles, you increase your risk by 1 micromot. Driving 250 miles or flying 1000 miles in an airplane is as risky as taking ecstasy. And horse riding is about 2 micromots. You're probably not going to die with any of these activities, but it certainly surely does increase your risk of dying by a fraction. And there is so much of misinterpretation of facts going on today during this COVID crisis. When a scientist says that there is no evidence that the vaccine blocks transmission, we interpret it as his having said that vaccines do not stop transmission. There is evidence that this virus spreads by person-to-person contact. Gets interpreted as there is no evidence that the virus spreads through the air. There is so much we do not know about this coronavirus, its transmissibility or its mutation, and so many other things. But absence of evidence is not evidence of absence. It's generally true and an important corrective to a tendency we sometimes see in medicine and science, where a scientist or a press person says there is no evidence that X causes Y, when what actually they want to say is that we are not very certain whether X causes Y. Maybe it does, maybe it does not. The phrasing is important because the way language works colloquially, how it works in the world, when the scientists say there is no evidence that X causes Y, we hear it as X does not cause Y. Now, do lockdowns really help? Well, lockdowns are useful if in this process of lockdown, locking the population indoors, is utilized gainfully to augment the national resources, to augment the national efforts to tackle the disease. Just lockdowns in themselves will not be of any help, because lockdowns over an extended period will increase mortality, because lockdowns cause unemployment. It is known that a 1% increase in unemployment in a country like United States, which is a developed country, increases the mortality of the population by 37,000. So you can well imagine the cost of unemployment in underdeveloped countries or developing countries like India, in which this 1% mortality will be magnified into 5% mortality. And if you see the figures of the population of India and other populous countries like China, this will be a large decimation of population by mere lockdowns for extended periods. So lockdowns do not help. Lockdowns should be used only as an opportunity to augment resources, because they will not cause decrease in mortality during COVID times. There is an often asked question whether hair transplant is safe during the pandemic or not. Well, the International Society of Hair Restoration Surgeons, which is the leading society in the world with maximum membership, states that if certain precautions are followed, hair transplants can be continued during the pandemic as well. A hair transplant is an office-based, daycare, minimally invasive procedure. A procedure which does not exhaust medical systems. A procedure which does not occupy unnecessarily hospital beds. Also, a hair transplant is not an aerosol generating procedure. During a hair transplant, the patient is not required to breathe into a closed circuit, which can cause cross-infection in subsequent patients. And oxygen requirement in hair transplant is very rare. For example, in my practice, over the last 15 years since I have been in hair transplant practice, I have seen that yearly amount of oxygen that I utilize is not more than 2 liters. It is very rare that you need to give oxygen to a patient during a hair transplant. So a hair transplant is not only safe, but is also not a drain on existing medical systems while we are fighting the COVID pandemic. So what is the population that comes for a hair transplant? Is it a young population or is it an old population which is more susceptible to the virus? You take any hair transplant practice today and you will see that the commonest age group, that is over 90% of the clientele of a hair transplant practice, would be between the age of 25 to 35. Now in this age group, the risk of dying, the micromort risk of dying from COVID is very low. This population 25 to 35 is 11 times more likely to die from other diseases this year than due to COVID. Another way of looking at the risk of dying due to COVID is COVID carries a risk of 30 micromorts. Now, 30 micromorts is the risk of dying if you travel 10,000 miles in a car. And this 10,000 miles is usually covered by people in 1 year. So, in the 25 to 35 year age group, the risk of dying due to COVID is very low. And getting a hair transplant done in this age group, if proper precautions are taken, if government guidelines are followed, is not a big risk at all. So no matter how you slice and dice the data available, this age group 25 to 35 is at very low risk of dying because of COVID. So hair transplants in this age group, if proper guidelines are followed, if governmental guidelines are followed, is not a risk that is worthy of comment. And this risk continuously will decrease over the months ahead, because as more and more people get vaccinated, as the government lowers the age of vaccination, the risk of transmissibility and the risk of dying because of coronavirus will continue to decrease. But there's a word of caution here. When there is a spike in the number of cases, when there is a wave which is not settling down, that is the time one should be cautious, sit at home, try your best not to venture out, follow government guidelines, and once scientific data shows that the infections are coming down, then you can seek out your hair transplant. So the ICHRS, which is the premier association of doctors who practice hair transplant surgery and is based in the United States, has given some guidelines and stated that hair transplants can continue, can go on during the pandemic, provided some safety guidelines are in place. There should be proper patient selection. A series of tests should be done before the procedure, regular taking of temperature, minimizing contact with the patient and amongst the staff, and use of certain filters called HEPA filters, and use of ultraviolet lights. So as a COVID protected facility at Darling Buds Clinic, what are the systems in place? How do we ensure that your safety is the highest priority at Darling Buds? Well, these are the precautions that we take while doing hair transplant, and we have been doing hair transplant quite regularly since the last 1 year. So what are the measures we have put in place during this COVID pandemic to ensure patient safety and safety also for the staff and the doctors? Number one is that we restrict the number of patients visiting the clinic to a bare minimum. Now, how do we do that? The first patient interaction is through either an email or a WhatsApp message or a Skype call. Once the pictures have been seen, once we have done an in-person video consultation, which I do personally, after that, we have to establish the need for the procedure. Once the need for the procedure is established, that is, the patient is a candidate for a fruitful hair transplant, we proceed to guide the patient to come in for an in-person consultation. Many times, an in-person consultation is not required at all, and the patient can come straight for the surgery. We were doing this earlier as well. All the patients who travel internationally don't come for in-person consultations. So if the patient decides to come for an in-person consultation, if he feels comfortable to first come and see the doctor to establish a proper doctor-patient relationship, he is most welcome, but he is told to come at a given specified time. A time for the consultation is pre-decided, and the patient is advised not to come with friends, family or colleagues, to come alone, or if at the most he has to bring somebody, he can bring one person, one friend along or a relative. But during the consultation, we do not allow anyone to accompany the patient except the patient. Nobody else is allowed inside the consultation room. And before the patient comes to us, he has to have an RT-PCR negative report in the last 72 hours, and his temperature is checked at the gate. The patient is also asked for a history of any illness or any contact with a patient who has been COVID positive. So if the patient decides to go on with the procedure, whether online or after an in-person consultation, whenever he does so, two things are taken into account. One is that 2 RT-PCR reports should be negative. The last RT-PCR report should be done at least 72 hours before the procedure, and the patient is advised to self-isolate 7 days before he reaches for the surgery. Similarly, all our staff are routinely advised to get RT-PCR tests done, and if any staff member has an RT-PCR positive result, it may be a false positive without symptoms, still the staff member is asked to quarantine for 2 weeks. Daily temperature checking of the staff is done at our clinic. The staff is not allowed to come to the clinic in public transportation. We have an earmarked, dedicated staff bus which ferries the staff to and fro from their homes. It's a door-to-door conveyance, and this ensures that the staff members do not get inordinately exposed to the virus while traveling by public transport. Moreover, for those who have come to our clinic, they will see that our clinic is very big, airy rooms, and there are multiple rooms and multiple open spaces. So we make very good use of these open spaces by isolating people. The operation theatres after every surgery are fumigated. All surfaces are sterilized. All door handles are cleaned every day twice. So this is the amount of effort that we are using during this pandemic to have safety in the procedures that we do. And touch wood, during this last 1 year that we've been operating, and we've been doing an average number of 3 to 4 surgeries in a week because of the decreased demand for hair transplant during this period. But we have not had a single patient who was RT-PCR positive after getting this procedure done. We have not had a single person of the staff who has had fever or who has had RT-PCR positivity during this period of 12 months. So I think these guidelines, these strict guidelines that we follow, are the reason behind our success in curtailing the visitation of this coronavirus to our clinic. So to further prevent the spread of this virus, we do very stringent and methodical patient selection. Patients who are diabetics, whether controlled or not, are avoided. Patients who have heart problems are avoided. Patients who are obese, patients whose BMI is more than 30 are avoided. And we do not do procedures on people who are heavy smokers or patients who have lung disease. So many times I'm asked this question, how has the pandemic has ravaged so many industries. So many industries are not the same as they were before. So the question that they ask me is, Doctor, how has your hair transplant industry been affected? Well, it has been affected hugely. All the patients who were traveling from abroad have suddenly stopped coming because there are no flights to India. And many patients within India are scared or apprehensive of traveling because there are so many flight restrictions. And then flights have become very expensive too. So this is the way that the pandemic has affected our practice. But then there are other clinics who are not run by doctors, run by commercial companies. These clinics have been affected a lot. Patients have increasingly come to know that safety precautions cannot be given a short shrift. Patients are asking questions. Patients do not want to go to a clinic where the clinic is a one-room clinic, where the clinic does not have life-saving measures like oxygen and so many other things, where the clinic doesn't have the cover of an anesthetist, where the clinic does not have qualified doctor, qualified staff doing the procedure. And I hope and wish that this patient awareness continues even after the pandemic. Patients are getting very well educated during this pandemic, and the social media has helped in patient education in a great manner. So is there a risk of people who are vaccinated spreading the virus? So to this I have to say that there is no such thing as zero risk. None. A piano might fall on your head one day. You might have a car crash when you're driving down to office. Your television might electrocute you. An asteroid can strike you as well. Or more likely, your resistance in joining back society once you're vaccinated and once the pandemic is on the wane is going to come with all the risks and damages. Or if put another way, if you're vaccinated and still do not want to mingle with society, do not want to return to the same lifestyle you lived before the pandemic, then what's the point of getting vaccinated? Then what are we here for? This pandemic has messed with our lives so much like we have never seen before. But as this pandemic continues to fade, it still continues to keep us in its hold, even when the vaccine is here. There is always risk in this world. There has been and there will be in future. Much greater risks than this pandemic brought along. We have to be cautious. We have to take care of our health and remain safe. But we have to also realize that COVID-19 is not the only risk that we face. And when we're vaccinated, when most of the world is vaccinated, it is actually one of the smallest risks. The only thing on this earth that is zero risk, it's death. All the risk is gone. But we're alive now, and the COVID-19 clouds will soon lift. And when they lift, let's try to see the sun. So with this, I end this video. If you have any questions about the pandemic as relates hair loss, COVID-19 as relates to your medication, or any other doubt that comes to your mind about hair loss or hair transplant, or any matter related to hair transplant, I'll be there for you to answer any of the comments that you make on my channel, on any of the videos. Thank you for watching once again, and God bless you.